Hi, this is Dr. Arun Kannan, orthopedic surgeon from Apollo Hospitals, Chennai. I specialize in hip and knee surgery, and in this video I'll talk to you about a useful but a slightly off technical topic, which is insurance coverage for knee replacement surgery. Knee replacement surgery is become quite popular of late, with a lot of people, especially over 55, making full use of a knee replacement to gain a pain-free walking and a good lifestyle. So the question of insurance comes in. Fortunately, most of our insurances cover the knee replacement surgery quite well. In fact, even a lot of the state government insurance schemes as well as the CGHS, they give coverage for knee replacement, but at sort of selected hospitals. But in general, most of the insurance policies issued in general through office or you've taken on your own, they cover knee replacement quite well. There are some exceptions, like if you take an individual policy and there is a waiting period generally of about 2 to 3 years before you can have a joint replacement, either a hip replacement or a knee replacement, and covered by the insurance. This is because it is a chronic condition, meaning you could have had like knee osteoarthritis and pain for several years, and if you take insurance now and expect coverage within a month for a knee replacement surgery, generally it does not happen. It still can be done through some if it is part of a larger corporate policy where your parents are covered, then it could cover from the start. But if you have taken an individual policy, generally it takes 2 to 3 years waiting period to cover for a knee replacement surgery. So if you have insurance and you want to have the knee replacement done through insurance, generally, we would have seen the patient first, decided for a knee replacement, then we work through the insurance process. Most of them are cashless, but approval for the cashless facility, we need something called a pre-authorization form. This is in the hospital, or insurance section will have the form from your insurance company. Details will be filled partly by me as the treating surgeon, filling in the condition and what treatment is to be done, how many days you are expected to stay, all that we will put it in. And then you give your details, meaning how long, what's your age, address, and ID proofs, all that is given. And the hospitals submit it on your behalf to the insurance company. The insurance company will generally approve the insurance. Sometimes they might have a query like how long the condition has been or what caused the condition and all that. Those are all queries that comes from insurance. We address them and send it back. And generally within 1 or 2 days, most of the insurances will give an approval for a knee replacement if you are eligible for it. So once the approval comes, then you will get eligibility for this cashless claim, meaning you can get admitted to the hospital, have the surgery, and the insurance has approved that they will bear the expenses on your behalf. And by only when at the time of discharge, the insurance company would receive the final bill from the hospital, and then they will give you or they will tell the hospital what amount they will be paying for this surgery. And in general, most of the insurances would cover 90% of the expenditures if it is within the claim limit or how much insurance is available for you in that period, in that year. Some of the things that are not covered by insurances are non-medical expenditure, like food, or like sometimes they consider disposable items like gloves and things like that as non-medical expenditure. Those are not covered. And some insurances have a co-pay, meaning if insurance pays 90%, then you will have to pay 10%. And very rarely some insurances have a limit on how much they pay for a knee replacement. But overall, in general, for most of the cases, they pay about 90 to 95% of the bill. So at the time of discharge, you pay the rest of the 5 to 10%, and then you can get discharged. So as far as how much it costs in insurance versus patient without insurance, there isn't much difference generally. We have the same packages almost for patients who are doing it without insurance as compared to people with insurance. Some of the insurance companies have a pre-fixed package with the hospital, wherein it is slightly with a little bit discount. They have fixed a package with the hospital, and so it works out to be slightly less expensive than going without insurance in many cases. So Overall, insurance gives good coverage, and they take care of the in-hospital expenditure quite well. Apart from this, there is something called a pre-hospitalization and post-hospitalization coverage as well, meaning generally tests done related to the surgery before you get admitted within 15 days, or like post-operative, after surgery, once you get discharged, next 15 to 30 days, whatever you spend related to the surgery, if you submit the bills with a reimbursement form, many of the insurances reimburse a good portion of that as well. So in our place, we lot of our patients have insurance coverage, and we have a good network of all insurances, and many of our patients are able to have a hassle-free experience because of the tie-ups and the insurance coverage. Thank you.